is CBS 2 News.
Could this machine be the answer to your low back pain? I'm Dr. David Marks, and I'll have the story coming up.
Well, it affects a lot of people, but chronic back pain is not something you should have to live with.
Dr. David Marks is here with details of a brand spanking new treatment.
That's right. Now, doctors treat lower back pain with anything from acupuncture to surgery, but there's a new non-invasive treatment that may help some patients. 40-year-old Robert Ruo was an active, healthy New Yorker, but 4 years ago, while walking into a store, his back gave out.
All of a sudden, I literally couldn't walk. I was incapacitated.
He immediately went to see chiropractor Drew Demand.
I crawled into the back of a taxi, and I came directly here.
Robert had herniated a disc in his lower back. Dr. Demand thought he was a perfect candidate for a new procedure called VaxD. When a disc herniates, the soft center bulges out, and this can push on the nerves. The idea behind VaxD is it pulls apart the spine. This creates a vacuum that draws the disc back into place. Patients lie on a computer-controlled table that applies gentle traction to their spine. And here's the result. This is an MRI of Robert's lower back. You can see the disc protruding. After 4 weeks of VaxD treatment, there's a marked improvement.
Here's the same patient after treatment, and this is where the disc herniation was. And what we're looking at now is a rather small disc bulge.
Dr. Demand is one of the few doctors in the area who has the VaxD machine, and he's seen it work for many patients.
The 4-year follow-ups are excellent. Most patients, about 80%, are still pretty much very close to asymptomatic when we discharge them.
Robert is one of those success stories.
I have an 8-year-old son who's quite active, so I do everything with him from